Well, I'm the president of the organization, so in many ways I tell our staff that I'm the person in charge of connecting the dots to make sure that when we have issues that our regulatory team is looking at it, and that the marketing team and the communications folks are looking at it from that perspective, and that we're addressing whatever the problems are in the industry really from an integrated standpoint. So I'm in charge of making sure all those things come together. Absolutely. We're real excited about a consumer program that we have now called Vitamin D and Me, which is providing education around the research that has been coming out over the past 2 years about the connection between vitamin D levels and the incidence and severity of COVID-19. There has been now over 100 studies done in the last 2 years looking at these connections, and the majority of that evidence is indicating that there is absolutely a connection between higher levels of vitamin D and lower incidence and severity of COVID and some of the symptoms that come along with that. So we're trying to make sure consumers are aware of this information, and then they can make more informed decisions, talk to their healthcare practitioners about getting their vitamin D levels tested, and in many cases, if supplementation is the appropriate response, to start a program where they're increasing their vitamin D levels. I would say the question that I'm getting the most from companies is what's going to happen with N-acetylcysteine, and I'm really surprised how many companies are concerned about this. Even companies that may not be making an N-acetylcysteine product, they see the potential impact that this could have if FDA is allowed to take a product that has been in the market since before DSHEA was enacted, and for economic reasons remove it from the dietary supplement marketplace. So it is about N-acetylcysteine, but it's about so much more. So I just have been taken to how many companies are watching this issue. We're hoping we're going to get resolution on this pretty soon. It's a little overwhelming after spending the last 2 years, pretty much on Zoom calls. But it's also exciting. I think there is so much energy this year. People are glad to be back. They're excited to see the innovation in the industry. There are lots of new products, new claims. So you can feel that kind of momentum. But at the same time, being back on the trade show floor where you're being pushed along by the crowd, that's a feeling we haven't felt in a couple of years. The biggest and I think most lasting impact that COVID-19 has had for our space is the awakening in so many consumers that they need to take a more active role in their health care. We saw initially sales shoot up. I think a lot of people in the industry were concerned that maybe that was just pantry stocking in the first couple months. And then the sales continued. Consumers used the products they bought, and then they went out and they bought more. And we actually have been able to see a change in the way consumers view their role in their health care. So they want to be more active. They want to take more autonomy over those decisions, and they want to do things to stay healthy. All of those are really positive things for this industry because we are positioned to answer all of that. On the other side, of course, now we're facing the supply chain problems that have come as a result of the pandemic. But I think we'll figure out ways to overcome that. The lasting impact of COVID will be the change in how consumers view their products. Well, we have a very ambitious agenda for the next couple of years. Obviously, we are still working on trying to get a legal pathway forward for CBD and other cannabinoids. So from a legislative standpoint, that's an issue for us. An even bigger objective for us is working on access to our products. Through our CRN Foundation, we are trying to increase people's ability to access our products, whether it's through getting them covered in flex spending checking accounts and healthcare savings accounts, whether it's getting a recognition by insurance companies on how we can save money for the healthcare system by bringing down healthcare costs if people use supplements, to then even a broader application of access is making sure that underserved populations who really do need these products, maybe even more than the people who are buying them, that they can get access to nutrients and they can participate in their health care in the same way as our current buyers. So the best way for people to learn about CRN initially is just to go to our website, crnusa.org. We have a lot of materials there that are available to the general public. Obviously, there are other parts of it that are only available to our members. But for companies who are interested in actually joining CRN, start at the website, give us a call. They can call me. Our Vice President of Membership is Carl Hyland. I think he knows most everyone in the industry already. But we're always eager to talk to companies who want to join.